Hello everybody. Yeah, so I suddenly realised at 5:02 that the post I'd been sharing for today didn't include the YouTube link. So I had to get that from Chris. And then I tried to log in as Chris, as I usually do when giving these presentations, but Zoom has now brought in two-factor authentication, so that wasn't possible either. So apologies for being here a little bit late. Right, so, and I also just discovered that my talk from the convention in Johannesburg was made wide format. So I don't know how it's going to come over in today's presentation, but we can try. Hi there, Francoise. Hopefully more people will be here and hopefully it's streaming to YouTube as well. Great to see you. Thanks, Freeman, for being there right in my face so I know that we're in safe hands. Right, hello there, everybody. I'm Dr. Alison Grimstone. I'm just going to see if I can spotlight myself for everybody, but I might have to be host to do that. Yeah, so I can't. So whoever is logged in without falling over the... Oh, here we go. That's it. There we go. Right. So hello everybody. Hi Robin. Thank you for your messages. Very exciting what's going down in Africa at the moment, isn't it? Hi Christina. Great to see you again today. So I'm Dr. Alison Grimstone. I'm a functional medicine doctor. I've been a doctor for 30 years. I'm trained as a GP, but I specialise in women's health and women's hormones, but I also now specialise in long COVID, chronic Lyme disease and chronic fatigue conditions. I work in the UK, as you can probably tell from my accent, and my clinic is all virtual for now. We do have clinics in Birmingham, Leeds and London, and London is where we do our IV antibiotics for chronic Lyme disease. So I'm here today to talk to you a little bit about patching, about the different sorts of patches, and a bit about detox, a detox reaction, which many of us find that we or our clients experience. And so it's good to be there ready with answers when people do have questions about this. You can warn people about it. About 10% of people will have a detox reaction, but they're more likely to if they are somebody who tends to be unwell, tends to react to other medications, or if they have a chronic infection like chronic Lyme disease. So we see with the chronic Lyme disease patients that they're much more likely to get a detox reaction. Anyway, that's another part of the talk. So I haven't created a slideshow for this part. Let me just... Okay. But I have created some thoughts to share. So we're going to talk about the different patches because we don't tend to have product training here. In LifeWave, the This Is It team teaches you to really focus on the X39. Now, why is that? Because it's the patch that sets this company apart from anything else. It's the patch that makes the most magic. It is the one that is helping us to heal from the inside out. Now, before I go any further, I'd like to remind you of our disclaimer, and you do need to be using this frequently. Our patches are wellness devices. They're not medical devices. This is a wellness technology. And these products are not created to treat, cure, diagnose, or improve the symptoms of any disease. If they do, that's just like a side effect. What we're doing with the patches is we're enabling the body to get back to a state where it can heal itself. So we're allowing the body to be able to do more. We're allowing the body to allow more flow of energy and more healing to take place. So I've been using these patches for myself, my family, my clients, my brand partners, and my clinical practice since 2023. Incidentally, we're not allowed to use them in the NHS. The NHS is purely for pharmaceuticals, don't you know? That's the UK's National Health Service for those of you who aren't in the UK, because I know most of you are actually in the South Africa team 333. So I want to share not just what those patches do, but how to think like a confident patcher so you can support your clients and yourself more powerfully. We don't have to memorize complicated protocols. Though we love Jen's patching manual, I'm sure somebody will share the link into the chat for me. This is a brilliant book, and if you haven't already got it, I recommend you do. It's a very small investment for the benefits that you get from it. But what's more important is learning to think in systems. Think about what's inflamed, what's not functioning optimally, what needs support. Is it energy? Is it detox? Is it repair? Is it pain relief? Or is it actually emotional balance? Or in many cases, it will actually be a combination of those. We know that in functional medicine, which is a very deep root cause approach to medicine, we know that everybody's affected by their emotional balance, by their spirituality, and by their ability to repair, and by their energy, and by detoxification. I mean, even as you are sitting here in front of a computer, you are being affected by the EMFs that are being sent out by the computer, by the Wi-Fi, by your microwave, and on top of that, you've got pollution. If you're not eating organic 100% of the time, and that's really quite difficult, then you will be exposed to pesticides. So every person that you see will need support in many of these modalities. Once you know that, once you've started to think about what's inflamed, what's not functioning optimally, what needs support, you'll instinctively know what patch to reach for. So let's talk about the different types of patch. First of all, the X39. I'm just going to get some of my stock out of my drawer down here. Didn't quite get the chance to get it all ready because I was on a call until 5 to. Yeah, I've got all of my stock out. Right, so X39. Ta-da! This is your foundation patch. It increases GHKCU, and that activates the stem cells and that activates stem cell related pathways. Think of it as bringing your blueprint back online for repair. Most people start here, and most of the testimonials you will see, especially those pertaining to the This Is It team, will be about X39, because you may, for those of you that don't know, the 333 team and my own team, the Liberate Your Life Online team, are part of the This Is It team, which is why we are able to use some of the This Is It team resources, such as the thisisitinfo.com website, the thisisitteam.com website. And their approach in America is very much focused on the business and on the X39. Why is that so effective for your business? Because if you keep things simple, people don't get confused, and the confused mind doesn't buy. They'll just get too confused. So if you want to have huge success in LifeWave, just focus on X39. This is the one that makes the most huge difference, makes us stand apart from anything else. So I started with X39 in February 2023. And the first thing I noticed, even with X39, before adding in Silent Night or Alavida, my sleep improved. So sleep can improve that quickly. Fibromyalgia, if you think of Chris's mum, she had not slept for 14 years. And it wasn't an immediate effect of X39. It was 5 weeks. But after 5 weeks, she rang him up in tears because she had been able to sleep through the night for the first time in 14 years because she had chronic fibromyalgia. For those of you that don't know, fibromyalgia is a complex condition. Now remember, I'm mentioning disease states, but these aren't for diseases. We're not treating, we're not diagnosing, we are supporting the body. Okay, so if you think about fibromyalgia, it's a chronic pain condition. There's pain in the joints and in the muscles. It's also a chronic insomnia condition, and it lowers your threshold for feeling pain. So people with fibromyalgia, they genuinely feel more pain than the next person. So you know that there's going to be some inflammation going in there. So an Eon is going to be a good one to use with that as well. But in this case, you know, if you've got somebody who can only afford one patch, it needs to be X39 every time. If they can only afford one sleeve, it's X39. Okay, so she started patching. She patched every day. After 5 weeks, she finally started to see the improvement. Other people see an improvement much more quickly. There have been people with tinnitus whose tinnitus improved 70% within a few hours of putting the X39 on. So there are all sorts of situations where we see improvement. But remember, the patches are not treating any disease. They are helping your body to heal the underlying situation. So we'll come back to some of those situations later. Now think about X49. So X49, that's this one with the old and intense packaging, and inside it looks like that. So much the same, but with X49 on. This is a wonderful patch. So the X39, the reason the X39 is so powerful is because stem cells are our progenitor cells. They are cells from which all our other cells are created. And you have a supply of stem cells that are there for healing. So when you cut yourself, the stem cells are involved in that healing. When you have a heart attack, the stem cells are involved in that healing. So we want to optimize our stem cells. As you've seen many times from our presentations, I'm sure the number of stem cells that are actually active in the body decrease over time. So the X39 can help you to heal anything. We've seen improvements in eye problems, in muscle problems, in joint problems. Think of Warren, who was in a wheelchair for 4 years due to the pain after he was shot, and he's now rock climbing again. You think of Ingi, who had her trigeminal neuralgia. X39 was pivotal in the improvement in that. It was slow. There was an improvement at the beginning, but it didn't go away for 7 months, I think. But it was there, and it may not be tangible. If you and your clients can't feel or see a tangible improvement within the first few days or weeks, keep reminding them that at some level it's healing inside. Your body knows what needs to heal first. And it may not be the knee pain that you're aware of. It may be the fatty liver that you're not aware of, that it's healing first. So that's X39. And I'll answer questions later. X49. So this one, I love this one. It's so powerful. It works alongside the X39. So we recommend using them both together if you're going to use X49 rather than just using the one. X49 improves bone density. It improves muscle and gives cardiovascular support, so it helps with cardiovascular issues. So it's wonderful for my menopausal, perimenopausal, postmenopausal women. But the other thing it does, when combined with the X39, it aligns your copper ions in your cells and creates a Faraday cage, so protects your body from the EMFs, from all the tech that you're surrounded by. Radiation, EMFs, all of the electricity. And I found that brain fog, I didn't even know existed, disappeared as soon as I put that second patch on. I didn't try the X49 for well over 6 months, but it's a great patch to add in. And you will see as we talk through each patch, you will get a feel for this idea that actually, if and when we can afford it, when our commissions reach that level, we would benefit, everybody would benefit from every single patch. I use all of the patches, except I only use the energy enhancer occasionally. So X49 is great for bone, muscle and cardiovascular, is great for blocking EMFs. It enhances fat burning and stamina. And I use this in clients with osteoporosis and fatigue or cardiovascular risks, which is why it's so good for perimenopause when we're trying to improve our bone density. So we see an improvement in people's energy and walking distance after cardiovascular issues because of this improvement in cardiovascular support that we see. We see improvements in muscle. So you'll see people will perform better. So athletes love this patch as well. The next few patches I'm going to focus on are for inflammation, stress and immunity. They're called the YH trio. They were created at about the same time. They are the glutathione, and I haven't got a carnosine here because they're upstairs. So the glutathione, the carnosine and the eon. Oh, is that it? There, no. So the glutathione, the eon and the carnosine. And you'll see at the top of the patch, above the top of the pack, it'll say YH. So these are a trio of anti-aging ones, and they make up what's called the LifeWave facelift. So I put these on my eye mask that I wear overnight to help with sagging skin that comes with age, and it makes a difference. But what do we really generally use Eon for? So Eon, it's one of my favorite patches. It's my favorite first patch in sensitive or inflamed clients. It reduces oxidative stress and balances the autonomic nervous system. It reduces inflammation. Now, coming back to what I said about thinking about what's underlying, inflammation is underlying almost every situation that you'll come across. If someone's got a painful hip or a painful knee, there's inflammation going on there. If somebody is exhausted and not finding energy, there's inflammation going on there. If somebody's having a headache, there's inflammation going on there. If someone's had a heart attack, there's inflammation going on. So it's very, very helpful in almost every situation. It's great for chronic stress, fatigue, and for detox reactions. And if somebody can afford 2 sleeves of patches, I'll give them this and the X39. Now, if someone's very vulnerable, like my chronic Lyme disease and chronic fatigue patients, these ones I will start with Eon first because it helps to reduce the inflammation in the body. It will give the X39 a better chance of starting to work quickly, and it will reduce any detox reaction that you get. Usually, in most people who are relatively well, I will just start with 12 hours, and we often recommend this for overnight. But if you've got somebody who's a bit vulnerable, so my post-viral clients, I will start with 4 hours or even 2 hours. I've even had somebody react to having it for 90 minutes. So in that person, we're starting at 30 minutes and building up. So in those people who are very vulnerable, who have a lot of things going on in their body, maybe they've got mold toxicity and chronic Lyme disease and heavy metal toxicity, we're going to need to be gentle, and they're much more likely to get that detox reaction, which we're going to come to later. So we start and slow and build up. Now remember, with these, each patch has about 16 hours of wearing. The crystal lattice in the center starts to deteriorate after 12 hours. And so I've got some energy enhancer here to show you. So you can see there's a raised center that's got nanocrystals in, and it's those nanocrystals that deflect the infrared light from your body back into the body at a narrow wavelength that then activates any particular peptide that patch is created for. So that's why they're all individual, because the angles of the crystal lattice are different. So with the Eon, we're starting with 4 hours and build up, and you'll see when you take the back off, if you keep the backing, you can reuse them. So for these ones where you're building up, they can use it for 2 hours and then 4 hours the next day, and then 6 hours or 8 hours the next day. So they can use that for 3 hours. Just put the backing back on it and put it back on afterwards. If you are very active, you might find you need to put a micropore tape or something on it to keep it in position while you're out and about. And if you are doing this gradual increase in eon, you'll be wanting to do it during the day rather than the night. So once they've built up to 8 or 12 hours, then you can switch to nighttime for the eon, which is very convenient. The next one from the YH trio is the glutathione patch. So this is our master antioxidant, glutathione. It's really, really important. It's depleted in most of us, especially any of our chronic fatigue and chronic post-viral clients. So we want to start very slowly with this one because glutathione is powerful. Anybody who's had a glutathione infusion will have felt that. The great thing about this is that it increases our own glutathione level by 300%, which blew my mind when I discovered that as a functional medicine doctor, because supplements will only increase it by about 20 or 30%. An IV infusion will increase it by maybe 100%, but it's short-lived. A liposomal product or transdermal cream will increase the glutathione level by maybe 70%. But this increases it by 300% and it can keep on working. So because we're helping the body to make its own glutathione, we're not giving glutathione. So it's not straight in and then finished. So it's often a good idea to go slowly with the glutathione, maybe 2 hours every other day to start with. And you'll see in the information leaflet that comes with it that they often recommend using it alternate days. So you don't necessarily need to have it every day anyway. With our intravenous clients, we are using a glutathione infusion once a week. So it's absolutely fine to use it just once or twice a week or 3 times a week. Use it when detox symptoms appear or with clients who just can't clear toxins easily. If you've got somebody with mold toxicity and they're struggling with their management, this can really help. We also find that in people with chest infections, surprisingly, putting a glutathione below each collarbone can also be helpful. And that can be helpful too. So lots of uses of glutathione, really important antioxidant, and we're very privileged to have that. And then the third of the LifeWave patches, which is upstairs from the YH trio, is the carnosine. I love this for tissue repair and neurological issues. It's great for scarring and gut integrity. So if you've got leaky gut, it can be very helpful, and anything to do with the eyes. So it can improve eyesight. It can help with healing after a cataract operation, any eye issue. We've even seen improvements in some health situations that are considered to be irreversible, put it that way. So anything that involves the brain, nerves, or eyes. So I would add it to X39 and Eon for somebody with a neurodegenerative disorder like MS, Parkinson's, Alzheimer's, anything like that. Anyone with an eye issue, and we often recommend putting it beside the affected eye overnight. And it's very, very good for scar healing after surgery. So really good patch to add to your armory. Next, I'm going to talk about pain and structural issues. So our good old LifeWave, which I have here because I was demoing it in my client Q&A earlier today. So this is LifeWave. It is an acute painkiller. So unlike the others, it's not healing the underlying cause of the pain. It's like a painkiller. So we have had people manage to come off strong pain medications, have improvements where strong pain medications haven't had any effect. People coming off some of those opiates and gabapentin, as well as simple paracetamol. Now the LifeWave comes as a pair. This is really important. And it's about the electrical charge between the two. So I often find that the bigger distance between the two, the better the effectiveness. So if you've got somebody with chronic pain, like if someone has fibromyalgia, you've got pain all over the body, so all over pain, where you can't really pinpoint, or if they've got pain in 3 places and you don't want to use 3 sets of LifeWave, one for each place, then you can put it on the soles of the feet. So imagine this is my foot, you're putting it just there below the ball of the foot. Okay, the white goes on the right side, the tan goes on the left. Easy to remember because white and right rhyme, pointed out by one of my clients. So that's a great combination. So that can help with all body pain. And then if you've got pain in a particular place, then we use the clock method around the site of the injury. So say you've got somebody with a shoulder pain, you put the tan one on the point of the greatest pain. So I've got a pain here at the moment in my shoulder. So I put that on the place of the greatest pain. Actually, I'm using Eon at night for that. But say that's the tender point on my sternocleidomastoid, on my trapezius rather, okay? So I put the tan one there, and then you just take half the backing of the white one and you try different positions. So you might try there, you might try at the wrist, you might try across at the sternum, you might try under the ear, you might try the back of the neck. And when you get the correct, the place that's going to be the most effective, you'll see a radical improvement in pain within 10 seconds. So we're talking about from about 8 out of 10 pain to about 4 out of 10 pain or more. So that's what we're looking for. So you're using the clock method around the site of the injury or of the pain. All right. So that is the LifeWave. Make sure I put them back in the right places. And then we have the energy enhancer. Woohoo! I do use this occasionally, but it's the one I use the least out of all of them. Like the LifeWave, this comes as a pair. You've got a matching pair. So you've got a tan one and a white one. And again, you tend to have the white on the right, the tan on the left. I tend to put them under my clavicles, but if you're in a hot climate, the sweat tends to lift them off, I find, and I find them sort of down somewhere around my belly button by the end of the day. So you can hold them in place with micropore or something, or you can choose a different position. They can go on your wrists. The patching manual gives you some examples of places that you can put it. And how does energy enhancer work? Well, amazingly, it increases ATP production. For those of you with a science background, you will see that that's an amazing achievement to have a little patch that's increasing the production of ATP, which is our unit of energy in our cells. And it's brilliant for chronic fatigue and post-viral clients. And you can use it again on the feet below the ball of the foot. And you can find, athletes use these on race days, for example, or on days when they are training heavily, and they see a tangible improvement in their energy, more staying power. This was the first patch that was created by David, and you'll see pictures of some of our global athletes using them, like certain tennis players and swimmers and etc. So Michael Phelps in the gold medal winning Olympic swimming team, and one of the Williams sisters in the tennis was using them. Okay, so it's a great one to use, but it's not just for athletes. Okay, next we're going to talk about hormones, mood and brain support, and as it happens, my only pack of SP6 is upstairs in my bathroom. So SP6, it balances endocrine and metabolic function. It's great for blood sugar, appetite, perimenopause and cycle symptoms. We see improvements in reducing appetite. It's helping to balance that leptin ghrelin balance, which is those are 2 hormones to do with appetite that we didn't know about years ago. And I've seen a patient with horrendous menorrhagia, which is heavy periods, using just one SP6, and the flood slowed to a trickle, and it was much more easy to manage. So not everybody will respond to this, but it's a good one to give a go to. Okay. And then Alavida. So this is that one. Now, it's marketed as a skin and beauty patch, but it's much more than that. It supports pineal function. The pineal gland is deep within here. It's in the brain, and it often gets calcified. This helps to decalcify it. It supports pineal function. oxidative stress, and sleep. And I also use it topically on scars and pigmentation. I use it every night, and the silent nights one as well. So I alternate, but I will use the one that I've using for a second night as well. So I've got 2 patches on at night, apart from my YH trio on my eye mask. We are Dalmatians at the end of the day with lots of spots on us. So it helps with collagen, and it helps with the wrinkles in the skin, but it really supports good quality sleep and supports our visioning if we are into meditation, etc. And then silent nights helps with sleep and mood. It's often underestimated. It actually, in a study of insomniacs, 14 insomniacs, it increased their duration of sleep by an average of 66%, which is incredible when you've got people who've got chronic insomnia and have had trouble sleeping for decades. So that's the silent nights one, which is also upstairs by the looks of things, in my bedside table where it belongs. So here's my general progression, especially in sensitive clients. If you've got someone who can only afford 1 sleeve of patches, I'll use X39. If they're sensitive and they can afford 2 sleeves of patches, we start with Eon, with which we calm the system, we reduce inflammation, and we reduce any detox reaction. Then we add X39 for stem cell activation and tissue repair. And then once people are stable on Eon and X39, I will add in support patches to support detox with glutathione, or targeted needs with SP6 or Alavida. And using different patches depends on the goal. And remember, the dose is the duration. So you can shorten the wear time to reduce intensity if you've got somebody having side effects or detox reaction. And remember, these are non-transdermal, so nothing's going from the patch into your body. So remember, my top tips: don't overwhelm a sensitive client, go slow, make sure they're hydrating with good quality water, start in the daytime before switching to overnight. Detox is not necessarily, it's not a bad reaction to the patches. It doesn't mean you need to stop using the patches and you're allergic to them. It's healing in motion. And I'll cover this in detail in my next bit. So track what's changing. Use the health tracker, which is in the back office and and I'm sure your upline can share it with you. There's also a link to it in the toolbox that Team 333 uses. So use the tracker, track what's changing, including mood, sleep, energy, resilience, headaches. Sometimes it's subtle but cumulative. And if you used to have a headache every morning when you woke up and it was throbbing, 3 months down the line, when you've not had the headache for 2 months, you might not even remember that you had it. And that's why documenting is so helpful and much more powerful than just relying on our memory. Use that patching manual. I strongly recommend you get this. It's absolutely brilliant. And combine it with intuition and observation. So the intuition, thinking of inflammation, thinking of detoxification, thinking of what's the underlying problem that this person is struggling with. You don't need a diagnosis. Diagnosis is a Western medical approach to these things. We want to look at, these are the symptoms, they've got pain, there's likely to be some inflammation going on, etc. So these are tools, but not magic, and they support your body's own healing intelligence. Remember, we don't treat conditions, we support systems to function better, and that's the difference between suppression and true wellness. Here endeth the first lesson. So let's have a look at all your questions quickly. Lyme's disease and reactions regarding X39 from Carrie Ann. Thank you, Samantha, for sharing that link. That's very helpful. So psoriasis, hi Lady Clayton. So thinking about what is the underlying problem with psoriasis, you're thinking inflammation and you're thinking autoimmunity. It's an autoimmune disorder. So you've got to think about autoimmune diet, gluten-free, hydration, stress management, sleep quality, and then think about what I said. There's inflammation going on, so you want Eon at X39. After that, it depends what they can afford, but there's likely to be an element of detox needed, but the priorities are Eon and X39 every time. Sally says, my son had a heart attack, is diabetic, high blood pressure and cholesterol. Well, again, I'd love you to mention when you're asking what you think. Any diabetic really needs all of these patches. They need the X39 and the X49 for the cardiovascular system. They need glutathione to detox. They need the IceWave if they've got any pain anywhere. They're going to need the carnosine if they're having issues with the nerves like diabetic neuropathy. And if they're not got those problems yet, it's still worth patching them with that if they will allow you to, because diabetic retinopathy is so common. You want to stop that. My brother first had retinopathy from his type 1 diabetes. He was diagnosed when he was 7. He had retinopathy in his 30s, I think. And blood pressure is also an issue with diabetes, for which you need the X49 with the X39. But it's a really good idea to track. Ask him to get his full bloods done now. Ask him to repeat them in 6 months. It'd be wonderful for you and for us to see those changes. I always intend to, and never quite get it. Spinal cord injury, says Sharon. I have a few patches, X39, glutathione, SP6 and Eon. Any advice? So spinal cord injury, it's what you're seeing here. If you think about what I've said, you've got inflammation, you've got pain, you've got healing needed, and you've got a nerve issue. So you need X39, you need Eon for inflammation, you need carnosine for nerves. Okay. Yes, Francoise, I love Alavida too. Yes, Nadine, SP6 will be good for teenagers. Yeah. Yeah. So SP6, the leaflet says rotate it. Some of these patches, the leaflets say rotate. I don't bother. I just put it in one place. So with the SP6, it's supposed to go on your left leg. So I put it either behind or above my medial malleolus, which is the bumpy bit on the inside of your ankle, or I put it just below my knee. Simple as that. Yes, there are good YouTube SP6 videos and the patching manual. If you have no cartilage, then there is a protocol for regrowing cartilage in the knee, for example. So I would use that combination. Your upline will be able to share that with you, or the person who invited you to this talk. No, we don't get the patching manual from Sammy. The link was shared above, Francoise. I didn't know that it doesn't ship to South Africa. I believe that Lucinda's trying to get that sorted. So it depends, Annie. How long after Eon do you start X39? It depends. Anything between immediately. So somebody who's healthy like me, you can do it immediately. 3 days to 2 weeks. 14-year-old with patches. Well, with a 14-year-old boy, they're going to be pretty resistant to the patches. So if he's growing very fast, you need to get his growth hormone checked. Okay. So get him checked out by your doctor, okay, for hormonal issues, if you really feel he's growing too fast. And you he's going to want to build up some muscle. So I would use X39 and X49 if you can, and Eon to reduce any inflammation that's going on. SP6 might be helpful in that scenario as well. Right, so moving swiftly on. So this is a 30-minute talk on detox reactions. And I don't know how it's going to work because it's a wide presentation instead of I carefully changed it from narrow to wide, and here we are. I wonder if I've got a narrower version of it. Anyway, let's try. So if I do slideshow, presenter view, great. Yeah, because you've got a screen in front of you, you'll be able to see even though it's wide. Right, so far so good. Share, PowerPoint. I think we have it. Hopefully that will show okay. So Christina says that she's got a patient who can't tolerate Alavida or Eon. I wouldn't try glutathione first. I would try Eon for 30 minutes and build up very slowly. Make sure they're drinking plenty. Hydration is crucial. Right, so supporting the body through detox and healing reactions. So remember, this is not medical advice. Even though I am a doctor, I'm not your doctor. So I don't recommend, prescribe or sell LifeWave products to NHS patients. Sadly, it breaks my heart when you see people with chronic illness. Anyway, that's another story. I'm not talking about that right now. So why talk about detox? Why is this an important thing to know about and to be able to manage in your clients? Many people stop using the patches due to mild symptoms that are manageable. So if they understand detox, then there'll be better compliance, you'll get better results, and get better care. And it's particularly crucial for those people who are more prone to a detox reaction, like those with chronic illness, long COVID, Lyme disease, ME and chronic fatigue syndrome, fibromyalgia. These things we find people tend to be more prone to a detox reaction. Same way they'll get more of a detox reaction with herbal remedies and with antibiotics. So what is a healing crisis or detox reaction or Herxheimer reaction? It's a temporary symptom flare before any true improvement. Your body is beginning to mobilize stored toxins and pathogens. It reflects some deeper physiological shifts. It's a sort of homeostasis reset. And so it's particularly common in those with chronic infection or a high toxic load. So if you've got somebody with hidden toxins, like hidden heavy metal toxicity, they may have metal, they may have mercury amalgams in their teeth. They may have, like me, I've got off the scale lead poisoning, which who knows where it's from. I think it's probably from the lead piping in my house because I'm in a 16th century converted brewery, we may, it's very difficult from the history to tell if people are going to have a heavy metal toxicity. And the same applies to mold toxicity, actually. Mold is something that's really common. Virtually everybody I test it in actually has some mycotoxin issues. And that can be from food that's been stored incorrectly. It can be from coffee. There's only 3 makes of coffee in the UK at least that actually tests properly for mold. So it's very easy to get it from your coffee, sadly. And if you have a pollution exposure, if you are living near a field that's been sprayed with pesticides, if you're using strong chemicals in your home still, it's time to stop. And so you try and use natural products for cleaning your home. Try and buy organic where you can, because there'll be pesticides on your food. So wash them, okay? Wash your food before you cook them, before you eat them. And then in addition, these chronic infections like chronic Lyme disease and co-infections, they can be contributing. What happens is, when you start this process, whether it's a detox treatment program or using the patches, those toxins or organisms or toxic byproducts of bacteria are mobilized into the bloodstream before they can be eliminated by your kidneys, by your gut, by your liver, by your skin through sweat, by your lungs through breathing. And so they come into your bloodstream, they reach the brain, they give you the headaches, they give you the nausea, they give you the shakes, the shivers, or whatever it happens to be in your case, or diarrhea or constipation, all these things. So common detox symptoms: headaches, fatigue, body aches, skin rashes or eruptions. So you may find you're coming out with a skin rash. Digestive issues: constipation, bloating, diarrhea. Mucus, so you may get runny nose, you may get sinusitis, discharges from elsewhere. You may have sleep issues, mood swings, anxiety, you're having trouble counting sheep to get back to sleep again. You may have the return of old symptoms because your body's so used to giving you these symptoms. So they may happen too. And you may find you've got increased urination or strong smelling urine because your body is getting rid of things that way. So why does it happen? Well, phototherapy is activating cellular repair. So the response of the body is to mobilize those stored toxins. With the phototherapy, we're boosting antioxidants like glutathione. Even the X39 is boosting your glutathione level, and that therefore reactivates dormant viral or immune or inflammatory processes. The patching improves circulation and mitochondrial energy. And that begins the process of repair and regeneration. And when we're repairing and regenerating cells, or even organelles like mitochondria within cells, then there may be some broken up mitochondria that have to be excreted, broken up cells that need to be disposed of. And that may contribute to this detox reaction. So what's the difference between a detox reaction and an adverse reaction? Well, with a detox reaction, it tends to be temporary, although those of us on our chronic Lyme disease treatments for 6 months may find that it's lasting a lot longer than you would expect or hope, but it can last months, but it tends to be temporary. Whereas an adverse reaction or allergy type thing will be persistent and will happen every time you're using that particular drug or whatever it is that you're reacting to. The intensity of a detox reaction tends to be mild, whereas an adverse reaction is often much more intense. Resolution tends to improve with rest and hydration, but it tends to worsen over time if it's an adverse reaction rather than a detox reaction. And the detox reaction in itself, the meaning of that is it may reflect healing, whereas the adverse reaction may need product reassessment. So if you're worried, if you're concerned, then consult a professional. So questions to ask before you're starting the patches. This is a really good checklist. By all means, take a screenshot of this if you are talking to people about the patches. You might want to ask, are they on chronic medications? Have they had recent surgery or anesthesia? Because that anesthetic hangs around in the body and may form part of the detox reaction while you're getting rid of it. Have you had a vaccination in the past 6 months? Are you well hydrated? Do you have a history of trauma or ongoing stress? Or do you have a history of mold, heavy metal, or infections, as I've been talking about? So hydration is your number one support tool. So my formula is, if you're in kilograms, like me, and liters, then it's your weight in kilograms times 0.033, the number of liters per day that you need to be taking in. So if you're a 60 kilogram woman, you need to be taking about 2 liters a day. You can add electrolytes such as sea salt, lemon juice, coconut water. We recommend you sip slowly rather than gulping a whole glass down at once. It'll stay in the body better. And I would recommend filtered or spring water. Other detox support tips? Well, you need to do breathing, deep breathing and breath work. You'd be amazed how this helps. It's incredible. Our breath is actually one of our detox organs. So our lungs are one of our detox organs. So we are getting rid of some of those toxins through our breath. Gentle movement, walking, rebounding is particularly helpful when you're detoxing. Epsom salt baths or a sauna, so anything that helps you sweat, or the magnesium in Epsom salt baths will help with the detox process. Herbal teas, particularly things like milk thistle that supports the liver and dandelion that supports the kidneys, will be helpful. And emotional processing, such as journaling or somatic therapy, some way of processing the emotions. And if you do process the emotions properly while you're going through this detox process, it will really help, and it will make it much more transformational. And you will come out the other side a new person. You know, you'll just feel so much better for it. It's the bit that's so often left out when we're doing detox programs, but it's actually probably the most important part. So what to say to clients or patients? Some supportive language you can use about this healing process. So you can say this is temporary and it means your body is responding. Let's support your detox, not stop it. Slow is smooth and smooth is fast in the longer run. Start slow, 4 to 6 hours a day is absolutely fine. And reach out if symptoms persist. So be there to support your clients. Healing is not linear, it's a spiral. We would like it to be linear, we just like to get better. It's not as simple as that, is it? So it's a spiral, just trust in the process. So some particular considerations in long COVID and other chronic illnesses. Detox symptoms may reflect viral or bacterial reactivation in these situations. It may reflect biofilm disruption, so the chronic Lyme disease bugs build a biofilm over themselves so that your immune system can't see them. But if we're disrupting the biofilm with the effect of these patches, then that is going to make your immune system much more effective for it. It can also reflect immune modulation. Progress can be slow or layered. An emotional detox is common, and it's important to take that into consideration. Be patient and use pacing strategies. Don't feel you've got to keep doing more each day, because recovery from these situations is not a straight line. And the recommended patches that I recommend are Eon and X39, glutathione, and SP6, which helps with the vagal tone in these situations. So finally, detox is not actually a setback. It's a signal of deeper healing. Educated users are empowered users, and we like empowered users. We like people to understand, and people nowadays like to understand, and people have access to so much more education than they used to anyway. They can look things up. Symptoms lead to are part of your body communicating with you. So listen to your body, listen to the symptoms. And then if you make sure you're doing the hydration and the emotional support, you'll get smoother progress. Detox is the body's natural language of repair. So let's listen, not silence it. There we go. Whew. How about that? I didn't think I would finish in time, but I have. So I will have a look, see if we've got more questiones. Here we go. Yes, David, I went through psoriasis already. Yes, absolutely. Pachamama is asking whether it's okay to use zeolite while detoxing to remove the toxins from the body. Absolutely. Yeah, I recommend that as part of my protocols for mold detox, for example. Do the patches help you detox? Yes, I believe they do. If someone has had a vaccine, they can't use the product before 6 months post-vaccine. No, I never said that. You're welcome, Sandra. Are the symptoms more or less the same for Lyme and TBE? Now, I think is that tick-borne encephalitis? You see, I'm not familiar with tick-borne encephalitis. It's commoner on the continent. But yes, tick-borne encephalitis is more severe and can lead to death. It's very similar. I've talked to our global Lyme expert that I do an MDT with every week. And I talked to him about this because we had a patient who had had the TBE vaccine, but it didn't stop them getting Lyme disease. Okay. Glad it was helpful, Francoise. Thank you, Sharon. So vagal tone, we want to increase vagal tone. Vagal tone is to do with the parasympathetic system. So when we're in a case of fight or flight or freeze, we've got sympathetic overdrive. We're in sympathetic overdrive. So we want to increase the parasympathetic, which helps us calm down, rest and digest. You particularly need to improve to switch over into parasympathetic mode before eating or before going off to sleep, or when you wake in the night and you're trying to go back to sleep. So we want to increase vagal tone. That can be by eating celery or apple cider vinegar before meals. I recommend deep breathing and appreciation. Something called heart math utilizes these too. And you'll see that the heart rate variability on any apps that you have will improve with that process. SP6 will help with that because it's related for hormone balance. You're welcome, Sandy. I'm glad it was helpful, Mignona. Thank you, Robin. Great. Thank you, Pat Shamalma. Thank you, Annie. Emotional detoxing. Oh, that's that could talk forever on that, really. Well, I think when you're going through a detox of any sort, it's a beautiful opportunity to connect spiritually to whatever your spiritual beliefs are, or to move forward with that, to ground yourselves in contact with the earth, bare feet, to journal, to just let things flow. I recommend people with anxiety and stress to do morning pages, which are 3 pages of freestyle writing every morning when they first wake up. And you're not going to look at it again, you're not going to edit it. I recommend before people go to sleep to write down, to get rid of all the things that are worrying them onto a page. So I recommend having a one journal for getting rid of the thoughts and another one for gratitude. And then last thing before you go to bed at night, write down 3 things you're grateful for, not just what they are, but why, a little bit more depth. And with emotional detoxing, it's really doing some of the freestyle journaling. Just, get some questions. ChatGPT can give you some questions to help you. If you want to ask ChatGPT, what can I do to emotionally detox? I'd like to do some journaling. Then you'll get some amazing prompts that will really get your creative juices flowing. Yes, Cindy, I have a chronic Lyme disease clinic in the UK, but we see people globally except for the USA and Canada. Our insurance doesn't cover us for that. See, I got caught up in the emotional detox. Here we go. Elmian, thank you. I'm glad you learned a lot. Magda, glad you found it was helpful. Lovely to see you, Lady Clayton. Can't wait to see you again in real life, IRL. Rosie, any advice on reducing bunions naturally with the patches? I can't say that it would reduce the bunions, but bunions are basically osteoarthritis of the first carpometatarsal joint. So this joint in your foot, okay? So it's osteoarthritis. So all of the patching ideas for osteoarthritis or for joint pains will help. I can't say they will make your toe go straight again so you don't have the bunion, but it can reduce the pain. Cindy says, yes, I've told you about the Lyme disease clinic. Christina, lovely to see you online again. So glad you are part of my team as well. I'm very blessed with my team. Carrie Ann, you have TBE and Lyme disease. So yeah, well, you would benefit from any of the patches. So keep working on it. And I'm sorry you're going through that life journey, which is complex, I know. But it is curable. Whatever people say, it's just that they're only using 3 weeks of doxycycline, which is nothing. We use 6 months of 3 antibiotics, 3 weeks and 1 antibiotic is just not going to work. So Sandra says, a person on X39 and Eon with chronic constipation, more hydration encouraged. Yes, definitely more hydration. Well, my notes were saying that that one of the others can help with gut permeability issues, so that might be helpful as well. Let me just look at my notes for a moment. I mean, I know I said it as we went through. Gut integrity, carnosine of all things. So try adding in carnosine. Have you come across anyone with celiac disease who's been patching for 6 to 12 plus months? And have you found the response to gluten has changed? If you've actually got celiac disease, I mean, I recommend everybody be gluten-free, but not by using processed gluten-free products, by actually eliminating gluten-containing foods from your diet. You don't need to replace it with other sorts of bread. I've been gluten-free since 2016. So I don't think anyone with celiac disease should aspire to be able to eat gluten again. It's not what you should be aspiring to do. Okay. Thank you, Sepiso. Yeah, the recording, it'll be uploaded to YouTube. Well, it'll already be on YouTube, but it'll be uploaded properly with a proper thumbnail within 24, 48 hours. Yeah, thank you, Samantha, for answering that. Dementia. Yeah, so Faith, for dementia, for any, like I say, carnosine for any neurological or eye issue, but you'd also be wanting your Eon and X39, as I said, they're the foundation for everything, and certainly glutathione would be helpful as well. Yes, the patches can regrow cartilage. There's a talk from David that talks about it, and the person who invited you here probably has a copy of the image that shows which patch where. I couldn't get my husband to keep using it, but it includes glutathione on the knee, among other things. Glutathione and Eon and one of the others, maybe X39. Ah, lovely to see you, Turid from Norway. Wonderful. Yes, Cindy, you can contact me about the Lyme disease clinic. I'll put the website here, Dr. Finlay's .co.uk. There you go. So you go to that website and you can book an appointment virtually there. I've got a patient in Qatar, I've got a patient in Netherlands, I've got a patient in Switzerland, and I've got a patient in South Africa. So Bertha, I'm glad you've learned a lot. Eva, thank you. So lovely to have you in my team. David, yeah, well done. Yeah, it's not difficult these days, is it, David, to be gluten-free? Christina, inflammatory bowel disease. Aeon and carnosine is a good combination. Yeah, as well as X39, of course. And Carol, bunions with locked toes. So you've got some hammer toes as well. Some mobility in big toes. Right. So Carol says she has bunions and she's been using X39 for 5 months and she's seen an improvement in mobility of those big toes. So that's a good result. All right, everybody, I will now close the room down. Lovely to see you all. Thank you so much for having me. I do love the 333 team. And it was a joy to join you in Johannesburg. Lovely to spend time with you, Robin. It's so nice to see you there. Take care, everybody. Oh, and Freeman, of course. Always wonderful to spend time with you, whether it's in the UK or in Johannesburg. Take care. Bye.
La plupart des personnes pensent que leur burn-out vient de leur charge de travail, mais les personnes que j'accompagne le savent.